also known as herpes zoster, is a painful rash caused by varicella zoster virus. Welcome back to MKGI, Skin Care, where glow that matters. After a person has had chickenpox, the virus continues to reside in the body. Later in life, it can become active again, causing the shingles rash. The term shingles comes from the Latin word cingulum, which means belt or girdle. This is because the rash usually appears in a band or belt-like pattern. Shingles can affect people of all ages. It is particularly common in adults over age 50 years. It is also more common in people of all ages with conditions that weaken the immune system. Varicella zoster virus belongs to a group of viruses called herpesviruses. Other viruses in this group include herpes simplex virus, which causes cold sores, and shingles isn't life-threatening, but it can be very painful. Vaccines can help lower the risk of shingles. Early treatment may shorten a shingles infection and lessen the chance of complications. The most common complication is postherpetic neuralgia. This is a painful condition that causes shingles pain for a long time after your blisters have cleared. Shingles shows up on one side of your body, usually in one specific area. The rash starts as a cluster of small bumps. These bumps look different than the surrounding skin and present differently on different skin tones. On darker skin, they may be pink, greyish, purple, or brown. On lighter skin, the bumps appear red. The bumps will turn into fluid-filled blisters, which also vary in presentation. They can be red, purple, brown. The blisters usually dry out and crust over within 7–10 days. Shingles can be a very painful condition, and sometimes the pain lingers even after the rash has cleared up. Symptoms. Shingles symptoms usually affect only a small section on one side of your body. These symptoms may include pain, burning or tingling, sensitivity to touch, a red rash that begins a few days after the pain, fluid-filled blisters that break open and crust over, itching. Some people also experience fever, headache, sensitivity to light and fatigue. Pain is usually the first symptom of shingles. For some people, the pain can be intense. Depending on the location of the pain, it can sometimes be mistaken for problems with the heart, lungs, or kidneys. Some people experience shingles pain without ever developing the rash. Most commonly, the shingles rash develops as a stripe of blisters that wraps around either the left or right side of the torso. Sometimes the shingles rash occurs around one eye or on one side of the neck or face. Prevention. Protect yourself with the vaccine. CDC recommends 2 doses of recombinant zoster vaccine ECV, Shingrix, to prevent shingles and related complications in adults 50 years and older. Shingrix is also recommended for adults 19 years and older who have weakened immune systems because of disease or therapy. If you have shingles, protect others. Covering the shingles rash can lower the risk of spreading the shingles virus to people with shingles. Cannot spread the virus before the blisters appear or after the rash scabs over. When to see a doctor? Contact your healthcare provider as soon as possible if you suspect shingles, especially in the following situations. The pain and rash occur near an eye. If left untreated, this infection may lead to permanent eye damage. You're 50 or older. Age increases your risk of complications. You or someone in your family has a weakened immune system. This may be due to cancer, medications, or chronic illness. The rash is widespread and painful. Is shingles contagious? Someone with shingles can't spread shingles to another person, but they can spread chickenpox. The varicella zoster virus is spread through direct skin-to-skin contact with the fluid that oozes from the blisters. Shingles is rarely spread by breathing in the varicella zoster virus the way airborne viruses are spread. If your rash is in the blister phase, stay away from those who haven't had chickenpox or the chickenpox vaccine and keep your rash covered. Management and treatment. There is no cure for shingles, but there are treatments for managing the symptoms. These drugs may ease the discomfort and make the symptoms stop sooner, particularly if you start them within 72 hours of the first sign of shingles. They may also help prevent the pain that can happen months and years later, called postherpetic neuralgia. Over-the-counter pain medications. These medications include the following and may be effective in relieving pain: acetaminophen acetylphenol, ibuprofen, ibuprofen and medications, Antibacterial drugs may be prescribed if you develop a bacterial infection due to the shingles rash. Anti-inflammatory drugs like prednisone may be prescribed if shingles affect your eyes or other parts of your face. Are you familiar with milia or stubborn spots? For more exclusive videos, click subscribe and push the notifications bell. Thank you guys for watching and see you again in our next episode. Namaste.